let me ask you something. You probably know your blood pressure numbers, right? Maybe you're even on medication for it. But bet no one has ever told you what that pressure is actually doing inside your body right now while you feel completely fine. See, high blood pressure has no more symptoms. That's the problem. It damages quietly for years. And one of the first places it hits that almost nobody talks about is your eyes. I'm Dr. Alex, an emergency medicine doctor. What I want to explain is that the tiny blood vessels in your retina are identical to the ones in your brain. Same size, same structure. So, when high blood pressure damages your eye vessels, it's doing the exact same thing to your brain vessels. We can photograph your retinal vessels in 30 seconds, giving you as a direct window into your stroke risk years before it happens. The research is clear. In this video, I'll show you what the damage looks like and what you can do about it. Let's get into it. Ever wonder what high blood pressure is actually doing inside your body? It's not just a number on a machine. Let me show you what's really happening. Your heart pumps blood through a huge network of vessels. Think of them like roads, getting smaller and smaller as they reach important places like your brain and your eyes. These tiny, delicate vessels are designed for gentle, controlled blood pressure. But when that pressure is constantly too high, they start to get damaged. Slowly, quietly over years. You don't feel a thing. Now, here's the crucial part. The tiny blood vessels in your retina, the back of your eye, and the ones deep inside your brain are basically twins. They're made from the same stuff and react to high pressure in exactly the same way. This means your retina is like a window to your brain. A quick, 30-second photo of the back of your eye can show you as the health of your brain's circulation with no more scanners or discomfort. We call this damage hypertensive retinopathy, and it tells you us what's happening inside your skull. It happens in stages. First, the tiny arteries in the retina tighten up to resist the pressure. You won't notice this. Your vision is fine, but the process has started. If the pressure stays high, the vessel walls thicken and harden. On an eye scan, we can actually see where a stiff artery crosses a vein and squashes it flat. This is a clear sign of long-term pressure damage. And remember, the exact same thing is happening to the vessels in your brain. As it gets worse, these damaged vessels start to leak. We see tiny bleeds, like little flame shapes in the retina. We see cotton wool spots, which are basically mini strokes within the eye where blood supply has been shut off. When you see this, you know the protective blood-brain barrier is under the same attack. The most severe stage is when the optic nerve itself swells. This is a medical emergency, a sign that pressure inside the skull is dangerously high, and it requires immediate hospitalization. Now for the numbers that make this so important. A major study followed nearly 3,000 people with high blood pressure for 13 years. It found that those with even moderate damage in their eye vessels were more than twice as likely to have a stroke. And here is the shocking part. This risk remained high even if their blood pressure was being controlled with medication. The pills lowered the pressure, but they couldn't undo the damage that was already there. Another huge analysis confirmed that having this eye damage increases your overall stroke risk by 46%. For more severe damage, it's an 82% higher risk. And for people who had both the eye damage and signs of damage on a brain scan, the stroke risk was 18 times higher. 18! That is a life-altering number. The biggest problem is that you won't have any symptoms in the early stages. Your vision feels normal while the silent damage is happening. That is why a specific retinal health check is so incredibly valuable if you have high blood pressure. It's not just a standard eye test for glasses. Right now, this isn't standard practice for hypertension care in many places, but the science is crystal clear and the technology is widely available at most opticians. It takes minutes. The information it gives you can change your future. Understanding that your eyes are a direct window to your brain health is a game changer. It changes the questions you should be asking your doctor and how seriously you take that blood pressure reading every single morning. So, what can you actually do about all this? Let us talk about the practical steps you can take right now to protect your brain and your vision. Thanks for watching. Don't forget to like and subscribe for more health insights that can make a real difference. Everything you just described sounds really serious, and that's because it is. But I want to be crystal clear about something else. The early and moderate stages of hypertensive retinopathy are not a one-way street. The damage isn't necessarily permanent. Your blood vessels can recover. The damage can stabilize, and in many cases, it can actually reverse. Your body has an incredible capacity to heal when you give it the right tools. So, what follows is exactly what the evidence supports. No more magic supplements, no more complicated protocols, just the practical, proven steps that genuinely move the needle. First, get your eyes properly examined. I don't mean a standard check for glasses. You need a digital retinal photograph. Specifically ask for an assessment of your retinal vessels and tell them about your blood pressure history. Most high street opticians offer this. When you go, be direct. Ask them if they see any signs like arteriovenous nicking, hemorrhages, or cotton wool spots. If they find anything, take that report straight to your doctor and ask for a formal cardiovascular risk review. Don't just wait for your next routine appointment. Second, you need to understand your true blood pressure, not just what it reads in the clinic. The white coat effect is very real. Anxiety in a medical setting can spike your numbers. A single reading at the doctor's office is often not the full picture. Buy a validated home blood pressure monitor. The British and Irish Hypertension Society has a list of approved devices on their website. For 1 week, take your readings every morning before food, coffee, or medication after sitting quietly for 5 minutes. Take 3 readings and average the last 2. Bring this log to your doctor. This data is far more meaningful. Your target at home is below 130/80. If you're consistently above 135/85, you need to talk to your doctor. Now let's talk about sleep, because this is the most underestimated tool for blood pressure control. During healthy sleep, your blood pressure naturally drops by about 10 to 20%. This is called the nocturnal dip, and it's a vital recovery period for all your blood vessels. If you sleep poorly less than 6 hours, or have fragmented sleep, the dip doesn't happen. Your vessels are under high pressure 24/7, not just while you're awake. Over years, this causes major damage. Simply improving your sleep quality can lower your systolic blood pressure by 5 to 10 points. Keep a consistent sleep schedule, even on weekends. Get screens out of the bedroom. Keep your room cool and dark. These aren't just lifestyle tips. They are critical for your vascular health. Diet is another area where people look for complexity, but simplicity is key. The diet with the strongest evidence for lowering blood pressure is built on whole foods, vegetables, fruits, legumes, whole grains, nuts, and oily fish. At the same time, you need to cut way back on ultra-processed foods, refined carbs, and hidden sodium. The single biggest change for most people is reducing sodium. I'm not talking about the salt you add at the table. I'm talking about the salt hidden in bread, cereals, sauces, and processed meats, which makes up over 75% of our intake. While you're cutting sodium, increase your potassium with foods like sweet potatoes, spinach, and bananas. Potassium actually helps your kidneys counteract the effects of sodium. Most of us get way too much sodium and not nearly enough potassium. Fixing that imbalance makes a measurable difference. Physical movement is huge, and there's a specific type of exercise that might surprise you. Of course, aerobic exercise like brisk walking is great, but recent research has shown that isometric exercise where you contract a muscle without moving, like a wall sit or a plank, might be even better for blood pressure. A major 2023 study found that isometric exercise led to greater reductions in blood pressure than any other type. We're talking an average drop of over 8 points, which is comparable to a starting blood pressure medication. You can start with a 2-minute wall sit, repeated 4 times with a 2-minute rest in between, just 3 times a week. No more gym, no more equipment, no more cost. Chronic stress is not a soft issue. It's a physiological one. It keeps your stress hormones high and your blood vessels constricted. One of the most evidence-based ways to combat this is slow-paced breathing. Aim for about 6 breaths per minute for 10 minutes a day. There are free apps that can guide you. Treat it like a daily prescription. Finally, if you smoke and you have high blood pressure, you need to be direct. Nicotine immediately constricts your blood vessels, and smoking directly damages their lining. When you combine smoking with hypertension, the risks don't just add up, they multiply. The single most powerful thing you can do for your health is to stop smoking completely. your local health service likely has free, effective programs to help you quit. The message here is simple. Your blood pressure isn't just a number. It's a force acting on every vessel in your body, including the ones in your eyes that give you as a window into your brain. The early damage is reversible, but only if you act. Get your eyes checked, know your real numbers, and make the changes that are proven to work. That's what I want for everyone watching this, not to meet me in an emergency, but to never need to. Thanks for watching.